Mr. Ruiz for 5 minutes of questioning.
Thank you, Dr. Cohen, for being here and for taking on the incredibly important role as CDC Director. I serve as ranking member of the Select Subcommittee on the Coronavirus Pandemic, and I believe that the value of looking back at the government's response to the pandemic is to be more prepared going forward. So, Dr. Cohen, what are the most important lessons to take away for CDC and the public health system from the pandemic, and how are you applying those lessons? And I know you've talked a lot about it, so let me ask it in a different way. If you were to choose one thing that could make the biggest difference, what would be on top of that list?
Well, thank you, Representative Ruiz. It's always hard to choose just one because, look, this is a hard amount of work, and I certainly bring a lot of lessons learned from North Carolina. Maybe I'll focus on operational excellence. I think it's really important to pair the science and the evidence and the data with execution, meaning the ability for us to deliver for the American people a response effort or a vaccine distribution that is effective, and so making sure that we have systems that work. Certainly we've talked a lot about data, but having systems that coordinate between federal, state, and local, and that we have that the infrastructure to make sure that we are delivering for the American people. So I see CDC already moving in that direction, and what I mean by that, we're not just putting out recommendations related to vaccines, we're putting programs in place that allow people to get vaccinated. For example, the Bridge program. This is a program stood up, first time, very incredible heavy lift for CDC to stand up this program so quickly, but is offering free vaccines for the un- and underinsured across this country. And so that's the kind of work we need to pair with the good data to say that these vaccines are safe and effective. We also have to break down barriers of cost and access at the same time.
And so as you begin your tenure at CDC, what should our priorities be in Congress to improve the nation's readiness for a future health emergency?
Well, thank you for that. I think a partnership with Congress is so important. We've talked a lot about needing the resources and authority to be the national security asset that we need, but I'll also say it's really important that we align to share good information about tools folks can use to protect themselves. We know that folks want to leave COVID in the rearview mirror, but it is still here with us, and it is important to have a shared voice saying, hey, use these tools that are safe and effective. I'm certainly going around the country doing that. I'd love to have more voices join that chorus. But again, the communication is important, but we need those resources and authorities that allow us to do our job well.
And some of our Republican colleagues have raised concerns about CDC's Federal Select Agent Program and CDC's inspection of a facility in Reedley, California. Can you explain the role of the Federal Select Agent Program in biosafety? And is there anything you would like to clarify on the CDC's response to reports about the Reedley facility?
Well, thank you, Representative Ruiz. You know, the report that was put together on this did have a number of inaccuracies, and I do want to make sure we're clarifying that the investigation was run by state and local officials in California. It was run by FDA, FBI. CDC was brought in, to your point, around select agents. We were asked to join on site to investigate, could there be select agents on site. Our team was there for 2.5 days in an extensive review, took hundreds of pictures. We looked at invoices, we looked at freezers, and what was actually very notable was the absence of equipment that you would normally see if there were select agents. So whether it was protective equipment or safety hoods or what have you, none of that existed at this lab. And after that extensive review, you know, our team did conclude that there were no select agents on that property, and then again turn the investigation back over to the FBI and others who were in charge.
Thank you. You know, we face challenges in rural and underserved communities in getting public health information to them. What are some of the most persistent obstacles the CDC faces in getting public health information to hard-to-reach communities, and what strategies does CDC employ to try to overcome these obstacles?
So it is very important that we are reaching every community. I believe no matter what zip code you live in, you should have the opportunity for health. I think our most important tool here is partnership and trusted partners. So there are trusted partners that we work closely with who already are known by their community, trusted by their community. And again, we're focused a lot also on making sure our health providers have the information and tools. We know that they're trusted, doctors and nurses, and those are folks that we want to make sure we're partnering with.
Thank you.
Thank you.
Thank you, and now I call on myself.